Welcome to session 2 of the newborn care curriculum. This session will cover newborn basics and infant safety, what is normal and not normal for baby, and how you can keep baby safe. After delivery, baby's umbilical cord is clamped and cut by your nurse or your support person. The airway is cleared of secretions and baby is warmed while skin to skin with mom. At that point, an APGAR score is given. An APGAR score is a score based on how baby is adjusting to being in the outside world. Is baby vigorous? We look at heart rate, respiratory effort, muscle tone, reflex irritability, and color. In the first 2 to 4 hours of life, baby will be in a quiet, alert state. This is the best time to initiate breastfeeding and skin to skin. Skin to skin is when baby is on mom or support person without a shirt to maximize contact. It is very beneficial for bonding and breastfeeding, as well as maintaining baby's temperature and blood sugar. After skin to skin, 2 ID bands are placed on baby which match mom and support person. A security band will be placed on baby's ankles. Alarms will sound and elevators and stairwell doors will lock down if tampered with. A security band is used so you can be assured that baby is safe while you rest. After bands, baby's weight and measurements are taken. While you're with us, baby will be with you the duration of the stay, only leaving the room for hearing screen, circumcision, and or certain blood tests. Routine care includes a thorough evaluation by a doctor. Antibiotic eye ointment is applied to baby's eyes to prevent infection. Administration of vitamin K to prevent bleeding. Hepatitis B vaccination to protect against liver damage. And umbilical cord care to prevent infection. We also monitor for jaundice and low blood sugar if needed. The first bath is done usually after 12 to 24 hours of life. The bath is delayed to allow vernix to absorb. A barcode will be at your bedside to scan and complete your birth certificate. A technician will perform a hearing screen. And around 24 hours of life, we will reweigh baby, do an oxygen level check. We check for jaundice, which is again the yellowing of the skin, and a blood test is done for the newborn screening. The newborn screen is a blood test required by law that detects metabolic and genetic diseases. Some are listed here. You can refer to the Hawaii Department of Health website for a complete list. Newborn basics. With feeding, breastfeeding is highly recommended. Newborns should feed early and frequently. Breastfed infants should be fed as soon as possible after delivery, preferably in the delivery room. Babies should receive feedings 8 to 12 times a day. There will be some weight loss. It is normal after delivery, particularly in a breastfed baby. Weight loss beyond 7% requires a lactation assessment. Normally, infants stop losing weight by 5 days and typically regain their birth weight by 10 to 14 days. Greater weight losses prompt ongoing lactation assessments and interventions. We have our lactation support to you available even after discharge. Should we need to monitor baby's sugar, we'll do that if necessary. If you decide to get your son circumcised, we will guide you on circumcision care. Hyperbilirubinemia is an ongoing assessment for jaundice. High bilirubin levels can increase the risk of neurologic dysfunction. We initially use a non-invasive skin device to check levels, and if it's high, a blood test is done. Further monitoring is also done at your 1 to 2 day visit after discharge. So jaundice is the yellow discoloration of the white parts of the eyes and skin. This condition is common in newborns, especially in Hawaii, where there's a large Asian population. When babies are readmitted, jaundice is the most common reason why, especially 92% of infants. Lanugo is the fine downy hair that may be found on your baby's forehead, ears, and shoulders. It usually disappears by 2 months of age. Mongolian spots are black or blue spots that may be found on any part of the baby's body, which often fades by 5 years of age. If your baby has any at all, it will usually be on their back or bottom. Milia are white spots that may appear around your baby's nose. Although they may last for a few weeks, they do not need to be treated. Washing with clear water is all that is needed. It's not pimples, so please don't pop them. Molding is a newborn head molding is a common head shape that results from pressure on the baby's head during childbirth. You may have heard it as cone head, but we don't prefer to use that term. Newborn rash is a common rash in neonates. It appears in up to half of newborns carried to term, usually between day 2 to 5 after birth. Don't be alarmed. It may look like bug bites. Best to leave it alone. Stork bites are reddish areas that may appear on your baby's forehead, eyelids, nose, or back of the neck. These fade and usually disappear by 24 months. Vernix. Your baby's skin may be covered with vernix, a slippery white coating that protected your baby's skin during pregnancy. It will wash off or absorb into the baby's skin in the first 24 to 48 hours. That baby's so cute. Infant care. For the umbilical cord, you want to fold down the diaper to keep the cord clean and dry to promote healing. A sponge bath is usually done till it falls off, which is in around 1 to 2 weeks. For bathing, it doesn't have to be done daily and take no longer than 5 to 10 minutes. Initially, a sponge bath is a wipe down of baby's skin without getting saturated. Make sure to find a draft-free area, test the water with your elbow, and wash baby's hair last to prevent baby from becoming cold. It is okay if the cord gets wet as long as it's not submerged in water. After the cord falls off, then you can use the tub or the sink with the water not going above baby's hip and using a mild soap. Lotions can initially be irritating to a fresh newborn skin, and powders can cause respiratory issues, so we recommend not using them. Discharge criteria should be met according to the American Academy of Pediatrics. Discharge is usually in 1 to 2 days. The Mom and Newborn Center will see your baby 1 to 2 days after discharge and works closely with the lactation consultants at the clinic should you need it. When to call a doctor? Part of keeping your baby healthy is to know when to get help. Call your baby's doctor or the advice line right away if your baby has yellow skin or eyes, is sleeping all the time and difficult to wake up, even to eat, has a temperature under the armpit of 100 over 99 or under 96.5. If a healthcare provider advises you to, a rectal temperature can be done. If it's over 100.4 or under 97.5, please let them know. If baby is breathing rapidly, has repeated coughing, vomiting, or diarrhea, has redness or swelling around the umbilical cord or circumcision site, or has not had a wet diaper or stool in 24 hours. please refer to kp.org for a wealth of information on newborn care. So next up is infant safety. Please provide a safe sleeping environment by always placing baby on his or her back to sleep. You share the room, but not your bed. Keep baby's sleep area in the room next to you where you sleep, but please do not allow baby to sleep with you. Use a firm sleep surface. Keep toys, pillows, crib bumpers, and loose bedding out of your baby's sleep area. For more information, please visit safetosleep.gov. Did you know that vehicle crashes are a leading cause of death for children in the United States? Child restraints or car seats reduce the risk of injury by 71 to 82%. Nationally, car seats, booster seats, and seatbelts are used incorrectly up to 90% of the time. The recommendation is you keep your child rear facing for as long as possible up to age 3, until they reach the top height and weight limits allowed by the seat manufacturer. Please resist the urge to turn your toddler around sooner. They are 500 times safer facing the rear. Do not purchase any used car seats if you don't know the history. Please register your car seat when you buy your car seat, just so that they can let you know if there's any recalls of your seat. Do not use any aftermarket products. Do not add anything to your car seat that you did not get in the box that you purchased. Please check the expiration date. Make sure that the car seat was never in a car crash. And please avoid having any projectiles in the car. A water bottle can also be considered a projectile if it's just roaming around on the ground. For more car seat information, how to choose a car seat, how to install a car seat, please refer to those websites. There are many inspection stations around. Please look at KIPC, Keiki Injury Prevention Center.com for where you can get your car seat checked. Mom, are you keeping safe? Please make sure that you're wearing your seatbelt accurately. Please do not put the strap behind you, and make sure that the lower strap is on your hips. Make sure you have a proper adjustment also for your seat so that you are comfortable and decreases the risk of injury for baby. Be mindful of the airbags as well when you're pregnant. You will still need to wear your seatbelt accurately and properly. The airbags are designed to work with your seatbelt, but not replace them. If you are in an accident while you're pregnant, please seek immediate medical attention, even if you think you're not injured. Just let them know so we can make sure that we advise you otherwise. Thank you for spending your time with me. If you have any questions, we have our OB Advice Nurses hotline right there, our outpatient lactation consultant, and our Mom Newborn Center numbers right there listed for you. Thank you very much and have a great day.